121. Hypercalcemia can cause cardiac arrhythmias in cancer patients. True or false? Answer: true. Rationale: hypercalcemia, common in cancers like multiple myeloma, disrupts cardiac electrical activity, potentially causing arrhythmias, requiring urgent treatment with fluids and bisphosphonates. 122. Chemotherapy is safe for all cancer patients regardless of comorbidities. True or false? Answer: false. Rationale: chemotherapy safety depends on comorbidities, e.g., heart disease, renal failure, requiring dose adjustments or alternative therapies to minimize toxicity risks. 123. Lymphedema can be managed with compression garments. True or false? Answer: true. Rationale: compression garments promote lymphatic drainage, reducing swelling and lymphedema, a common complication of cancer treatments like lymph node dissection. 124. Tumor markers are always reliable for cancer staging. True or false? Answer: false. Rationale: tumor markers, e.g., CEA, CA-125, aid in monitoring treatment or recurrence, but are not always reliable for staging, which relies on imaging, biopsy, and clinical findings. 125. Hospice care includes bereavement support for families after a patient's death. True or false? Answer: true. Rationale: hospice care provides bereavement support for families, including counseling and resources, for up to 13 months after a patient's death to address grief and loss. 126. Ovarian cancer is the most common gynecologic cancer. True or false? Answer: false. Rationale: endometrial cancer is the most common gynecologic cancer, while ovarian cancer is less common but often diagnosed at a later stage, leading to higher mortality. 127. Chemotherapy can cause cognitive changes, known as chemo brain. True or false? Answer: true. Rationale: chemotherapy can cause cognitive changes, such as memory lapses or difficulty concentrating, termed chemo brain, which may persist post-treatment and require coping strategies. 128. A high-fiber diet increases the risk of pancreatic cancer. True or false? Answer: false. Rationale: a high-fiber diet is not linked to increased pancreatic cancer risk and may reduce the risk of other cancers, like colorectal cancer, by promoting bowel health. 129. Lynch syndrome increases the risk of colorectal cancer. True or false? Answer: true. Rationale: Lynch syndrome, a hereditary condition, involves DNA mismatch repair gene mutations, significantly increasing the risk of colorectal, endometrial, and other cancers. 130. Pain management in palliative care always requires high-dose opioids. True or false? Answer: false. Rationale: pain management in palliative care uses a stepwise approach, starting with non-opioids, adjuvants, or low-dose opioids, escalating only as needed to balance relief and side effects. 131. Lung cancer is often diagnosed early due to routine screening. True or false? Answer: false. Rationale: lung cancer is often diagnosed at advanced stages because symptoms are nonspecific and screening, e.g., low-dose CT, is recommended only for high-risk individuals, like heavy smokers. 132. Radiation therapy can be used palliatively to relieve bone pain. True or false? Answer: true. Rationale: palliative radiation therapy reduces tumor burden in bone metastases, alleviating pain, and improving quality of life in cancers like breast or prostate cancer. 133. Neutropenia is a side effect of radiation therapy. True or false? Answer: false. Rationale: neutropenia is primarily a chemotherapy side effect due to bone marrow suppression, while radiation typically causes localized effects like skin changes or fatigue. 134. Hodgkin lymphoma has a worse prognosis than non-Hodgkin lymphoma. True or false? Answer: false. Rationale: Hodgkin lymphoma generally has a better prognosis, with high cure rates, up to 90% in early stages, compared to non-Hodgkin lymphoma, which varies widely by subtype. 135. Therapeutic communication includes validating a cancer patient's fears. True or false? Answer: true. Rationale. Validating a patient's fears fosters trust and emotional support, a key aspect of therapeutic communication in oncology, helping patients cope with anxiety or uncertainty. 136. Wilms tumor is a common kidney cancer in adults. True or false? Answer: false. Rationale. Wilms tumor, nephroblastoma, is a pediatric kidney cancer primarily affecting children under 5, while renal cell carcinoma is the most common kidney cancer in adults. 137. Chemotherapy can cause secondary cancers as a long-term effect. True or false? Answer: true. Rationale. Certain chemotherapy drugs, e.g., alkylating agents, can damage DNA, increasing the risk of secondary cancers, like leukemia, years after treatment. 138. A sentinel lymph node biopsy is used to diagnose leukemia. True or false? Answer: false. Rationale. Sentinel lymph node biopsy is used for staging solid tumors like breast cancer or melanoma, not leukemia, which is diagnosed via bone marrow aspiration or blood tests. 139. Targeted therapies can cause skin rashes as a side effect. True or false? Answer: true. Rationale. Targeted therapies like EGFR inhibitors, e.g., erlotinib, can cause skin rashes due to effects on skin cell pathways, requiring topical treatments or dose adjustments. 140. Superior vena cava syndrome requires surgical intervention as the first-line treatment. True or false? Answer: false. Rationale. Superior vena cava syndrome is initially managed with corticosteroids, radiation, or stenting to relieve obstruction, with surgery considered only in specific cases. 141. Surgery is the only treatment for early-stage melanoma. True or false? Answer: false. Rationale. While surgery, wide local excision, is the primary treatment for early-stage melanoma, adjuvant therapies like immunotherapy may be used for high-risk cases to prevent recurrence. 142. Patient education includes teaching cancer patients to report fever immediately. True or false? Answer: true. Rationale. Fever in cancer patients, especially those on chemotherapy, may indicate neutropenic fever, requiring immediate reporting to prevent life-threatening infections. 143. Cervical cancer screening is no longer needed after age 65. True or false? Answer: false. Rationale. Cervical cancer screening may continue after age 65 if there is a history of abnormal results or inadequate prior screening per USPSTF guidelines to ensure early detection. 144. Fatigue in cancer patients is always psychological. True or false? Answer: false. Rationale. Cancer-related fatigue can stem from physical, e.g., anemia, treatment effects, psychological, e.g., depression, or metabolic causes, requiring a comprehensive assessment. 145. Hormonal therapy is used to treat prostate cancer. True or false? Answer: true. Rationale. Hormonal therapy, e.g., androgen deprivation therapy, reduces testosterone levels, slowing the growth of hormone-sensitive prostate cancer, a standard treatment approach. 146. Psychosocial support is only for patients with terminal cancer. True or false? Answer: false. Rationale. Psychosocial support benefits all cancer patients, from diagnosis through survivorship, addressing emotional, social, and spiritual needs at any stage. 147. Esophageal cancer is often linked to chronic acid reflux. True or false? Answer: true. Rationale. Chronic acid reflux causes Barrett's esophagus, a precancerous condition that increases the risk of esophageal adenocarcinoma, a common type of esophageal cancer. 148. Bone pain is a hallmark symptom of early-stage prostate cancer. True or false? Answer: false. Rationale. Early-stage prostate cancer is often asymptomatic, with bone pain occurring in advanced stages due to metastases, detected via PSA testing or imaging. 149. Antiemetics can prevent anticipatory nausea in chemotherapy patients. True or false? Answer: true. Rationale. Antiemetics, combined with anxiolytics like lorazepam, can prevent anticipatory nausea triggered by psychological cues in patients undergoing chemotherapy. 150. End-of-life care in oncology avoids discussing spiritual needs. True or false? Answer: false. Rationale: end-of-life care in oncology includes addressing spiritual needs, offering support through chaplaincy or counseling to enhance comfort and meaning for patients and families. 151. Chronic myelogenous leukemia is associated with the Philadelphia chromosome. True or false? Answer: true. Rationale: chronic myelogenous leukemia, CML, is characterized by the Philadelphia chromosome, a translocation between chromosomes 9 and 22, forming the BCR-ABL gene, which drives uncontrolled cell growth. 152. Chemotherapy is the primary treatment for all stages of lung cancer. True or false? Answer: false. Rationale: while chemotherapy is used for advanced lung cancer, early-stage lung cancer is often treated with surgery or radiation, and targeted therapies or immunotherapy may be used based on tumor characteristics. 153. Long-term smoking cessation reduces the risk of lung cancer. True or false? Answer: true. Rationale: smoking cessation reduces lung cancer risk over time by decreasing exposure to carcinogens, with significant risk reduction after 10 to 15 years of abstinence. 154. Mammograms are recommended for men with a history of breast cancer. True or false? Answer: true. Rationale: men with a history of breast cancer or high risk, e.g., BRCA mutations, may require mammograms for surveillance, as male breast cancer, though rare, can recur or develop in the contralateral breast. 155. CA19-9 is a tumor marker for pancreatic cancer. True or false? Answer: true. Rationale: CA19-9 is a tumor marker used to monitor pancreatic cancer progression or recurrence, though it is not specific enough for diagnosis and requires correlation with imaging and biopsy. 156. Radiation therapy can cause esophageal strictures as a late side effect. True or false? Answer: true. Rationale: radiation to the chest or neck can cause fibrosis, leading to esophageal strictures, which may present as dysphagia months or years after treatment, requiring dilation or stenting. 157. Tumor lysis syndrome is a common complication of radiation therapy. True or false? Answer: false. Rationale: tumor lysis syndrome is primarily associated with chemotherapy for high-burden hematologic cancers, not radiation, which causes more localized effects like skin or mucosal damage. 158. Neutropenic patients should avoid fresh fruits and vegetables. True or false? Answer: true. Rationale: neutropenic patients are at high infection risk, so fresh fruits and vegetables, which may harbor bacteria, should be avoided unless thoroughly washed or cooked to prevent foodborne illness. 159. Alopecia from radiation therapy is always reversible. True or false? Answer: false. Rationale: alopecia from radiation therapy may be permanent if high doses damage hair follicles irreversibly, unlike chemotherapy-induced alopecia, which is typically temporary. 160. Palliative care can improve survival in some cancer patients. True or false? Answer: true. Rationale: studies show that early palliative care in advanced cancers, e.g., lung cancer, can improve quality of life and, in some cases, survival by optimizing symptom management and reducing treatment burden.